It is with great pleasure that I have the opportunity to introduce Dr. Pearl Berman. She is a full professor of psychology at Indiana University of Pennsylvania. She is the immediate past president of the National Partnership to End Interpersonal Violence Across the Lifespan, NPEIV. A licensed clinical psychologist, she has provided treatment for the negative impact of child abuse, neglect, and family violence. Her research studies the impact of childhood adversity on adult experiences with violence. She has received the 2019 Rosalie S. Wolfe Memorial Elder Abuse Prevention Award, and she collaborated with the Zero Abuse Project to create child and adult advocacy studies, the CAST I just mentioned, which covers violence across the lifespan. She received the 2020 Child Advocacy Studies Award. Thank you so much, Pearl. The floor is yours.
Thank you, Katie. And what I'm hoping to do as the last speaker before our discussion period is to tie together a lot of the threads that have come from all of the previous speakers. And I'm also talking about public policy, but I don't want to bore you. I want to get you energized, even though you're probably really tired for sitting at the screen. And I want you to put lots of ideas, your great, creative, thoughtful ideas into the chat. Because if you look up at my screen, you see, once again, the common factors that have been found over and over again to build resilience in children, in adolescents, even in older adulthood. And the number one most important one is building relationships, but look at increasing your brain power. If you force yourself, even when you're tired, to try to generate ideas, it supports your own personal resilience. And you cannot help other people if you can't do things to keep yourself energized. And during COVID, it's had a very negative ability on our ability to build or increase our attachments and close relationships that help us get through the really tough times. We need to help people build their knowledge, their creativity, their problem solving. I'm intentionally going to be throwing out some ideas to you for what you might consider doing in your community that you're going to think, what is she talking about? When would we have ever done this? You probably have never done it before, because the whole point is let's stimulate your intelligence, your creativity, your ability to solve problems in this new world that we have that contains things like COVID in it. We need to help people learn to increase their ability to control and direct themselves. We need to help increase people's desire to master new skills. Yes, things are tough, but let's not give up. Let's get help. We need to build or increase faith and hope that life has meaning, so that while it's okay, we're feeling really down today, that doesn't mean our life doesn't have meaning. There are important things we're going to be able to do with our life. If we enhance resilience, it is our most powerful tool for reducing interpersonal violence, as well as other things we don't like in our society, like drug and alcohol abuse. We need to have more public policies that build resilience through supporting parent-child relationships. But why are they needed? Don't parents already know how to do this? Katie's already mentioned the fact that they help you in the hospital and then wave to you goodbye. Some of our parents do know what to do when they leave the hospital, but 30% of our population is estimated having 3 or more adverse experiences growing up, which could inhibit learning all the skills that might help them as adults. They may be more harmed than others by myths we have in our society that parenting just comes naturally. So if something's going wrong, it's because there's something wrong with you, versus that parenting is actually quite difficult. Parenting skills need to be learned. And some of us do learn some good parenting skills in our family, but we often haven't learned enough, and they can be learned in many other teaching environments. When people think that they should just know how to be an effective parent, they're more likely to hide their difficulties from even their friends, rather than reach out for help. Furthermore, we have parents in our communities who have experienced 5 or more types of adversity in their life: abuse, neglect, intimate partner violence. These are the 11 to 15% of our population who have never experienced a positive and secure attachment as a child or a supportive and safe adult relationship. Thus, they enter parenthood without the skills to build secure attachments to their infants and young children. Caregiving, whether of a minor, a dependent adult, or an older adult, is difficult and demanding. We aren't born with all the knowledge we need to do this, but we can learn the needed skills through seeking out help from needed experts in the field. But we presently have a lot of barriers to reaching out for this help. We need public policies that make access to experts across the lifespan much easier so that people can get the caregiving support they need. For example, we could ensure that all maternity hospital personnel are affected first responders who can recognize at-risk families and give them access to free outpatient support. There are mothers currently giving birth at hospitals who do not have enough positive support from family members or friends during pregnancy, delivery, or when they go home. Hospital personnel need to be able to identify these high-risk parents and be able to offer them free outpatient services, such as the nurse-family partnership. In this program, nurses visit homes twice a week for up to 2 years and provide support for parents learning how to develop effective relationships with their children. This program has been found to be very effective in reducing child maltreatment. Another strategy that they are talking about at the federal level, but we don't know if they'll provide it. We need to integrate mental health services into our school system to ensure that school personnel can be effective first responders for identifying at-risk youth and getting them access to free support. The children that are causing trouble in school, that are underperforming or are engaging in abusive substances, are much more likely to be the children who have already experienced and continue to adverse childhood events, and they need to be referred for comprehensive help, not punished or disliked by everyone at school. Math teachers shouldn't be expected to also be experts in knowing how to help students with serious behavioral and emotional problems. Policies could help support the integration of mental health within the school curriculum through having a new type of teacher certification for primary and secondary schools. This certification would be in the areas of emotional and behavioral health. This educator could help students build sources of resilience in their lives, such as how to build and maintain relationships, how to control their impulses in tough situations, constructive problem solving, and many other important skills. Just as in math and English, students would receive age-appropriate content that built from year to year to more complex social and emotional skills. This teacher would be very familiar with the mental health system, and so would know how to give what's called a warm handoff, which refers to going beyond just saying to a family member over the phone, you need to get your child help, but rather helping the family understand why getting help from this particular provider might be helpful to their family. Policies could make mental health even more accessible by having a therapist or counselor available in school, so that teachers who recognized there was a problem could literally just walk a troubled child down the hall. Policies that integrate mental health into the main institutions of our society, such as hospitals, schools, senior centers, police stations, would increase the ability to recognize and effectively respond to people who are showing the warning signs of violence or other social mental health problems. and help build a more resilient community. What could you do if you were a community member? You could call or email your senators and representatives and ask them to support policies that would make maternity wards good primary prevention sites. If they could also provide evidence-based programs like the Nurse-Family Partnership as a free referral so that at-risk parents could easily receive these helpful resources. You could decide to make yourself an effective first responder. If you know a young parent in your neighborhood or from a group you belong to, make the time. We're all very busy, but find a way to make the time to drop by and visit. If they're looking tired or seem to be struggling, say simple things like, needing help is normal. Infants can be tough to take care of, and that they shouldn't hesitate to reach out to you if they have questions or concerns. You can show them websites such as 0to3.org, which Katie's putting up in the chat for you, which has a lot of absolutely fantastic videos and handouts to help people with parenting that are absolutely free. If you're concerned about the children in your community who may not be getting enough support from adults, they could be the teenagers that are hassling you when you're walking through the parking lot. Give a few hours a month to help children and youth in programs like Big Brothers, Big Sisters, and provide a little more adult support to let these youth know that there are people in the community who value them and want to help them be successful in life. If you have any other ideas of what might work in your own unique community, write them down so you can think about them, or also so that we can discuss them in the chat as possible actions that could support resiliency in other people's communities. It's not just infants and young children. We need policies that can support all family relationships. There are adults in our community who are struggling with complex relationship patterns that develop between young children, teenagers, their parents, and their grandparents. In one family, the grandmother might be like a head of the household. She supports everyone in getting their needs taken care of. However, to do so, she may be neglecting her own health issues because she doesn't have time to think about herself. In others, a 10-year-old with physical challenges may be getting attention from parents that make the other siblings feel or actually be neglected, but then they feel guilty and angry about having these feelings. Let's face it, love might be infinite, but there's a limited amount of time in the day. And we have many family members with many different needs, and any one of them could feel overwhelmed or unsure what to do. We need to increase awareness that caregiving is hard and includes many skills, and to need help is normal. Public policies could increase awareness by giving more nonprofits the opportunity to contribute on our educational access channels and provide free programming to help educate people about the many different types of caregiving issues and possible solutions. For example, assume a paid home childcare worker is trying to help the 5-year-old learn their letters and numbers in preparation for kindergarten. Add to this task the fact that the child is showing some warning signs that might indicate dyslexia. How could we expect an unskilled person to handle the intense frustration this child might be experiencing, or know how to tell the parents when they came home anything more but that the child didn't want to practice? In another example, a grandmother who's developing dementia is now living with her adult daughter and grandchildren. The daughter works during the day and employs a home caregiver to maintain the grandmother's safety. Every day when the adult daughter comes home, the grandmother asks where her husband is. The adult daughter keeps trying to get her mother to remember that he is dead, causing renewed grieving. Any adult child could struggle with understanding what to do in this situation. How could we expect an unskilled person observing the situation to know what to say to advise? Right now, home health and personal care aides provide company for dependent adults and older adults across the country. However, these caregivers, they're also needing to help these adults with daily living tasks such as bathing and dressing. Yet the person needing help now is adult-sized. So attempts to provide this help can lead to injuries. Yet, according to the US Bureau of Labor Statistics in 2020, they earn an average of $29,000 a year. Would you choose to train for this job, knowing you'd only earn this salary? In addition to increasing awareness that caregiving involves complex skills, political leaders need to consider supporting tax relief for paying childcare, dependent adult care, older adult care, to make it more affordable for parents to get higher quality help, and for making advanced education more affordable for our future caregivers. All people are interconnected with others. Policies that build resilient caregiving builds the physical and psychological resilience of the community at large. What could you do as a community member? Use your own know-how to support families in your community. For example, remember, you might not feel like it, but you are a person with a variety of skills and experiences. Have you always been great in math? Consider providing homework support at local community centers and libraries where youth are hanging out without parents to help them with their homework. Another example, do you like talking to other people? Consider connecting with the Center for Aging in your area and calling people who are isolated seniors or shopping for them one day of the week and letting them know they haven't been forgotten. Do you enjoy your social media? Consider liking and sharing posts that are made by nonprofits who are providing free educational services to the community at large. Consider sharing the examples that you might be seeing on the 0to3.org website. Any of these steps help you further your own sense that you can do something to help and support building a strong community, because you're also building the power of the agencies in your community. Public policies should support our community relationships. Local police forces take action when episodes of violence begin. Hospitals do have emergency rooms for victims of violence, but communities don't have collaborations between agencies and stakeholders to provide ongoing, coordinated community action to support resilience. These collaborations would decrease the likelihood of violence happening in a community. Different collaborations might fit the unique strengths and needs of a given community. For example, some communities need greater access to quality, affordable food. Perhaps collaborations could be developed between grocery store chains, community centers, and public libraries to offer community members with free courses in how do you select healthy food? How do you plan for the week? What are the best strategies for increasing the healthy food choices available to your family at the lowest cost? All of these are critical skills for building the physical health of your community. Some communities have heads of the household working long hours so that their youth are often alone. Could senior centers work collaboratively with schools and community centers to provide homework support and mentoring resources for youth. Reciprocally, schools could promote clubs where youth make phone calls or volunteer their time playing games at senior centers, helping both groups realize the value added to having both in the community. Some communities have youth and adults who feel hopeless, that they will never earn a secure income. Perhaps medical centers could collaborate with high schools and vocational centers to provide structured mentorship for individuals who wanted to work in the medical field. Learning what these professionals required and meeting people who are already in these jobs could help young people and adults to build hope and faith that they can find future employment. What could community members do? Resilient communities require residents who speak up. Put the emergency numbers for Child Protective Services, domestic violence shelters, older adult protective services in your phone or on the wall of the store that you own or that you work in so that you're ready to call if the warning signs of trouble are present. Do you love animals? As you walk your dog, have you observed any animals that might be abused or neglected in your neighborhood? It is not uncommon that when an animal is being harmed, a person in the home is also being harmed. Call your local humane society or police station. When you are going about your daily life, have you noticed rundown parks or buildings that are sites for possible community risks, like drug deals? Consider writing letters to the editor of your local newspaper or encouraging a community leader to start a campaign to transform these risky environments into collaborative internet spaces for doing homework, relaxation spaces for just doing yoga and chilling out, where a mental health service could be physically present in case somebody needed help. Have you read something online or heard something while waiting in line that just disturbed you? Call 911. If you're concerned about the possibility of violence, you need to take action. We know there are many people in Uvalde, Texas, wondering if there could have been something they could have done to prevent the mass shooting on May 24th.
2 minutes, Pearl.
Consider how you would feel about being wrong after calling 911. Consider how you would feel about being right and not calling 911. It is better to be wrong and call, even though this can feel hard. We're already embarrassed before we've hit the first number. Successful advocacy requires repeated attempts at trying to support your community, even in the face of discouragement. Just trying and encouraging other people to try is to build your own sense of mastery, motivation, and belief that, yes, you can make a difference and help your community be more resilient. There is more than 30 years of research that shows that there can be what's called the intergenerational transmission of violence, where you start out with violent parents abusing a child, and then in the next generation, that child is now an adult abusing their children. This happens because families and communities are learning environments. Public policies could help communities intentionally move forward to create learning environments that support the intergenerational transmission of strengths. We need public policies that provide easy access to experts who can help when individuals and families are struggling. We need increased public awareness that caregiving is difficult and that it is normal to reach out for help at times. We need increased financial support for gaining education in how to be a good caregiver or in affording educated caregiving help. We need to provide incentives so that our communities can develop unique collaborations so that we have in place unique, ongoing emotional infrastructures for building resiliency in our particular community. Citizens need to speak up to their local and state officials about what their community needs to build resilience and ask their official, what are you doing? Citizens can reach out to people in their neighborhoods who may be struggling and offer compassion. Store owners could decide to put emergency numbers for child abuse, elder abuse, animal abuse up in a visible place to help community members know who to call when they are themselves in trouble or suspect someone else is. Communities include everyone. Thus, everyone needs to be involved in building a resilient community with reduced violence, drug abuse, and other social ills. To take action and learn more about violence and what you could do to help prevent violence, please go to the free violence prevention pages at the website that will be put in the chat. If you feel you currently have time to be a big part of the solution, please join us. Our network, the National Partnership to End Interpersonal Violence, is a coalition of the general public, psychologists, educators, lawyers, social workers. We are an inter-collaborative agency. Do you want to go out to the bright lights and sun of California? Join us at our 14th annual think tank in San Diego, where we plan our violence prevention activities for the next year.